Cheek will talk with us about women in sleep. So welcome.
Good morning. Sleep is as mysterious and as complex as it is familiar, and I would say the same thing is true about women. Some would say that even women who are familiar to them, are very complex and mysterious. I'm here to talk with you today about women and sleep, and it's a great honor to be here celebrating women. And so I decided to choose Sleeping Beauty as a symbol of what I'm talking about today. Now, granted, I never looked like Sleeping Beauty. I never will. I don't now. And you might think you don't either. But I say to you that inside of every woman, there's a beauty, and there's also a beauty outside. So I do think this captures it. And she also captures the sleep and the serenity that goes along with sleep. And you all know what sleep looks like. You've watched other people sleep. You've watched your baby sleep, your grandchildren sleep. We know what sleep looks like. And she captures that serenity. But what I liked about this picture is there's a variety of little figures floating around, and it shows up pretty good on the screen. And I think sometimes in women's busy lives, because they have so much going on, that this kind of captures what's happening for women's lives. So what I want to do today is talk with you about sleep patterns and influences on sleep across a woman's lifespan, from infancy to elder women who are wise women and have lived through all these experiences as a child, a teenager, and possibly pregnancy and then menopause, and share some sleep hygiene tips with you, which are common sense approaches to enhancing sleep naturally. Now, I want to tell you one caveat, and that is I'm not an expert on sleep in children. Okay, it says that on the program. I've had more experience with adults than I've had with children. But one of the things that you may or may not be aware of, the brain is very active during sleep. We formerly thought that the brain was passive because the body was passive. We thought the brain was passive, but we know that's not true. We do know that the brain is very active. I'm going to show you an example in a moment. But sleep onset is determined by how long you have been awake. Scientists are calling that the homeostatic process. If you've ever tried to stay awake for more than 24 hours, you know that you get sleepier and sleepier and sleepier. And I one time had the privilege of trying to keep women awake for 3 days. It was not easy. Then the other process that's going on is the circadian clock. You've probably heard of this as a biological clock or the body's clock, something like that. And that's kind of synchronized with the light-dark cycle, but the natural innate body rhythm is closer to 25 hours than it is to 24 hours. So every day it gets reset by the light-dark cycle. Now, people usually ask about the amount of sleep that you need. The amount of sleep you need varies with the individual. It's recommended that you get 7 to 9 hours of sleep. Less than that or more than that can be problematic. But there are people problematic for your health and have health consequences. There are people who sleep 5 and 6 hours a night, and they do very well, and so there are always exceptions to every rule. But usually the amount of sleep that you need when you're about 20 or 22 years old to awaken and feel refreshed is the amount of sleep you're going to need as an adult throughout your lifespan. Okay, and I said that sleep was very active. It's generated in different parts of the brain, just as waking is generated in the brain. And you've probably heard of rapid eye movement sleep. It is associated with rapid eye movements under the closed eyelids. And this was first discovered by watching sleeping babies just over 50 years ago in Chicago. We also have non-rapid eye movement sleep, where we have stage 1. You're getting drowsy, your brain waves slow down just a very little bit. And then stage 2 is usually considered true sleep onset. The brain waves change there somewhat. We don't know what all the changes mean. Stages 3 and 4, the brain waves get very slow. This is actually the deepest sleep. It's harder to awaken people out of slow wave sleep than it is out of rapid eye movement sleep. The only differences between stage 3 and 4 are that you have slower brain waves for longer periods of time. And these definitions have been agreed upon, and it's a standard way of scoring sleep so that we can make comparisons across studies in this country. But it is fairly arbitrary. Rapid eye movement sleep, as I said, you do have rapid eye movements, but it's accompanied by lack of muscle tone. The fascinating part about this is that your brain waves look like your brain when it's awake. It's fast and slow, rapid waves. And the lack of muscle tone is very important, because if you've ever dreamt that you were chased by a bear, you don't get out of bed and run across the room because you don't have any muscle tone, essentially. Okay, so if you do get out and charge into your dresser, and that has happened to people, that's a sleep disorder, that's a problem. You need to see a healthcare provider. Now, I wanted to show you sleep cycles across the night. I don't know why, but I like this graph. And so at the top here is awake, and then the stages are down the side, and then the hours of sleep. And a cycle of sleep takes about an hour and a half, and you don't necessarily go from stage 1 to stage 2 to stage 3 to 4. You might jump from 1 down to 3. But you can see that this cycle is repeating across the night. It repeats about 4 to 5 times in an 8-hour period. REM sleep cycles get longer. You can see there's greater distance there. And the stage 3 and 4 sleep is more predominant early in the night and dissipates over the course of the night. Now, there's quite a bit of hormonal changes and hormones that are released during sleep. You may have thought that melatonin was released during sleep. Melatonin is actually a hormone that's produced, and it's produced in response to darkness, and it's inhibited by light. Now, most of us do sleep during darkness, so that melatonin becomes associated with sleep, and indeed it does make you sleepy, but you don't produce melatonin because you're asleep. You produce it in relation to light and dark. Growth hormone is secreted in the night. Female hormones such as follicular stimulating hormone, luteinizing hormone, prolactin, hormones are released at the onset of puberty. I'm not going to go into these hormones because I have 20 minutes, okay? And thyroid stimulating hormone is inhibited in sleep. Cortisol is highest at the end of sleep, and sleep onset diminishes cortisol. So I want you to know there's a lot going on when you're asleep. And the other thing to think about is if you want to go through a full sleep cycle, you need to sleep at least an hour and a half. And I tell my nursing students that yes, they need to make sure their patients get at least an hour and a half sleep, because some of the sleep in the hospital is very fragmented. This is a slide of sleep across the lifespan, and here the black part is rapid eye movement sleep, and the light part is non-rapid eye movement sleep. And what I wanted you to see here is not the details of the numbers so much. This is hours of sleep up the side. But one of the fascinating things, I think, is that infants sleep about 16 hours a day when they're newly born, and about 50% of that, almost 50%, is rapid eye movement sleep. And this lasts until they're about 2, when then it decreases to about 25% rapid eye movement sleep. And if you think about it, that's a time that they're growing quickly, they're learning to walk, they're learning to talk, and there is, while we don't know the exact purpose of rapid eye movement sleep, some memory processing is associated with that. We know that people dream during REM sleep. It's also been termed dream sleep, but people also dream during non-REM sleep. So so that's one thing to note on this chart, is the rapid eye movement sleep with infants, and they have the most. And then as the person ages, there's less rapid eye movement sleep until there's about 20% over the adult years. So it decreases into childhood, and then over the adult years you have about 20% rapid eye movement sleep, and less when you get out here. Then the other thing is that, relatively speaking, this graph is pretty flat for adults. There's a little bit of change there, but really not very much. This shows alertness across 24 hours. So this is a way of looking at circadian rhythmicity of alertness. High over here, low, and this then is alertness across the day from 9 a.m. So let's say you're sleeping at night, you wake up, you're fairly alert, you stay alert in the morning. Now, then your alertness drops off, and that's sometimes referred to as the post-lunch dip. You've probably all experienced it. A lot of people think it's in relation to eating, but actually you don't have that after breakfast, and you don't usually have it after supper. So they have now learned that it usually occurs about 8 hours after you get up in the morning. You have this dip. You have increased sleepiness there. You have less alertness. Then in the middle of the afternoon, you're more alert, and it's really kind of hard to sleep about 4, 5, 6 o'clock in the evening. People are up running around. I had a boyfriend once tell me, oh, everyone in the neighborhood's out walking around, driving around. They get very active. And this, then 20 years later, I've learned explains that. And then later on, 10, 11 o'clock, there's another period of sleepiness, making it very easy to sleep. So if you were going to take a nap, early afternoon is a good time to nap. It's going to be hard to sleep just before dinner. You can lay down and rest, but you don't necessarily sleep very easily. Now, don't you just love this picture? And then I have to tell you what's wrong with this picture, because one of the things that we have a responsibility as mothers is to take care of our infants. And it's indicated that infants don't sleep in this position even though they like to. And even though you put them on their back, they cry a lot. But on their tummy, infants tend to retain heat. They tend to rebreathe carbon dioxide. And they also have more pauses in their breathing. So you know what I'm going to say next, and that is they're at greater risk for SIDS. And a baby sleeping like this has almost 13 times the chance of dying of SIDS as a baby who is sleeping on their back. And so I think it's very important to note this Back to Sleep campaign that has been in this country for the last few years, and it has made an improvement in the SIDS rate. And it's recommended that babies not sleep on their side because they will slide over to their tummies. And then after breastfeeding is established, you can also use a pacifier that also is known to prevent SIDS. Now, I wanted to speak briefly about children, and I think what you need to know about children is that, yes, they still need sleep, and from the ages of 5 to 12, they need about 10 to 11 hours of sleep each night. And so how do you know if your child is having a sleep problem? Well, if they have excessive, if they have difficulty going to sleep and they can't go to sleep, that may be a temporary problem. But if they have excessive daytime sleepiness and they're not sleeping well, that becomes a problem, that they can't function, they can't learn, their schoolwork is going to be compromised, and it can be due to a sleep problem. If they're awakening during the night and if they're snoring. Now, yes, there can be sleepwalking, sleep talking, and all those kinds of things. Usually they will outgrow those and they're not problems. But if they have excessive daytime sleepiness, they are snoring, you may want to check out that with your healthcare provider. Maybe nothing needs to be done, maybe it only needs to be monitored, but it's something to watch for. Then in the teen years, of course, there are circadian changes. Most people know their teenagers want to stay up late and they want to sleep in the morning. That's very common in boys as well as girls. And that's normal. That's that circadian clock again. We don't know why that happens to teenagers, but it does. It wouldn't be a problem if we didn't try to start schools early in the morning. Okay? If they started at 10 o'clock, we could probably get our kids there. But trying to get them there by 8 o'clock or so, it's a problem. Now, the other thing that happens to teenage women is they have the onset of menstrual periods. And if you think about this, this is probably going to last for 40 years. I was thinking about that. There are quite a few changes with menstruation, but in large surveys of women, they find that about half of women say that only 2 to 3 days of their cycle is their sleep disturbed. We know that sleepiness is increased after ovulation because after the woman ovulates, progesterone levels are higher, and progesterone is associated with sleepiness. So usually after ovulation, you will be sleepier, and then as you go along and you're completed one cycle and getting ready to have another period, then you probably are going to be a little bit more awake because the progesterone levels are lower. Other symptoms that are associated with PMS include bloating, moody, irritable, abdominal cramps. They can contribute to difficulty sleeping. Now, in early pregnancy, the woman may be surprised to find that she feels tired and sleepy. This is again due to increased progesterone. The baby pushes on the bladder, and there may be urinary frequency. This happens early in the pregnancy, and the goal then is to get as much sleep as you can. Sleep whenever you can. Sleep on your left side to improve blood flow to the fetus. Drink more fluids in the daytime, less in the evening, and bland snacks might help prevent the nausea. Mid-pregnancy, you may have more energy, but you still need to sleep a lot, so you need to keep that in mind. And then the baby moves higher, and so there isn't as much urinary urgency, but there is heartburn, and then you can avoid spicy foods. What you may not know is that in studies out of California by Dr. Catherine Lee, about 70% of women in mid-pregnancy experience frightening dreams, nightmares. And if these are terribly distressing, you may need to talk with your therapist about that. Now, late pregnancy is equated with poor quality sleep. Your back may hurt, your muscles ache, you have more awakenings at night, you're uncomfortable. It's common for women to snore. Snoring is usually due to nasal congestion. It can lead to high blood pressure. It's not a problem unless it's accompanied by daytime sleepiness, headaches, and swollen legs. If you have accompanying symptoms, then you want to be sure and tell your healthcare provider about that. Again, sleeping on your left side. If you have leg cramps, you want to avoid carbonated beverages because they contain phosphorus, and you also may be low on calcium if you have leg cramps. Restless legs are a symptom that you have a irresistible urge to move your legs, and you have to get out of bed to do that. If that continues, it can disturb your sleep because every time you lay down, you feel an urge to move and you have to get up. So you may want to talk that over with your doctor and see if there's some treatment that can be done for that. Being a mother will change your lifestyle and responsibilities. Earlier this week, there was an excellent article in the Missoulian on the pros and cons of bed sharing. You also have to think about feeding. It changes your relationships to your family members and also to your pets. I've had the 5-minute warning, so I'm going to try to go through I'm not going to talk too much more about mothers. Menopausal women. This is the big issue, and what do you do? And I know you had something this morning. These are common symptoms: night sweats, hot flashes, symptoms of insomnia where you have difficulty going to sleep. You might awaken during the night, sleep lighter, sleep less, maybe have breathing difficulties or snoring. That's common. And so what are you going to do? Maintaining a healthy outlook is very important. To have a balanced diet, avoid large meals at bedtime, limit your caffeine intake. Even if your caffeine has never bothered you, you may be more sensitive now. Limit sugar and alcohol. Control your bedroom temperature, that is, keep it cool. If you have bed clothing and covers, you probably want to have it lightweight. Get regular exercise. Vitamin E supplements may be helpful, and then any relaxation techniques you could think of may be helpful, and I put massage as an example. Listening to music, warm baths, drinking milk, those kinds of things are helpful. Now, as we get older, then men and women's sleep is a little bit more alike. They're early to bed, early to rise, and that's different from when they were teenagers. So that circadian clock has shifted. Sleep is lighter. There's usually less stages 3 and 4, less REM sleep. They awaken more. They still need total sleep, but they don't get it consolidated at night, so they also oftentimes sleep during the day. At any age, insomnia can be a symptom of depression, and sometimes it's hard to tell which comes first, the chicken or the egg. We do know that more women complain of insomnia, more women complain of depression than compared to men. If you treat the if you treat the depression, oftentimes that resolves the insomnia. So I'm bringing this to your attention. So if you're not sleeping, you may want to think about, have you been evaluated for depression? And then the other thing, there's a long list of medications that contribute to insomnia. That includes medications for colds or allergies, high blood pressure, heart disease, thyroid, birth control pills, medicines for asthma, pain medicines, and then SSRIs that are used as antidepressants. So I've got a couple of lists here of things that disturb your sleep, and I put on the back of the handout that's been distributed some websites and resources for you. There's a book about, for people who can't sleep, there's a book about children's sleep, and caffeine does disturb sleep. It can prevent you from going to sleep, and even if you sleep well, you will have a lighter sleep stage if you've had caffeine. Alcohol might facilitate sleep onset, but once it's metabolized, then you have a physiological arousal and it wakes you up. So it's particularly contraindicated for people who wake up in the middle of the night. Nicotine as a stimulant is contraindicated. I went over a list of medications. If you have irregular bedtimes and getting up times, that can be problematic. If you've known anyone who has worked as shift work, you know that to be true. Worries about finances can keep us awake. People in the environment, pets in the environment, cats and dogs can wake you up during the night, so you might have to set limits on that. Noise and light. I always travel with an eye mask and earplugs. Sometimes I have to use these at home. It's a little tough to get used to the earplugs at first, but once you do it, yes, you can hear your alarm through that, and yes, you can sleep better by blocking out some noise. The other way to deal with that is to have white noise as a background. Your room can be too hot or too cold. You can have tight bedclothes that you might not know are a problem. The biggest one is an old mattress. If you have back pain and are not sleeping, how long have you had that mattress? Most of the time they say 12 years is the maximum life of a mattress. Most of us have our mattresses for 20 years, which isn't a problem unless you can't sleep and you have back pain. Then I encourage you to evaluate that. Now, what can you do to enhance sleep? Daily exercise. They do have research that shows if you exercise in the morning, it's better than the evening for helping your sleep that night. And don't do it within 3 hours of bedtime. You can schedule time to worry in the evening. After dinner, schedule a half an hour. What are you worried about? Make a problem list. Write it down. One column, write down what you're going to do about it, starting with the next day. And that sometimes eases your mind that you have a plan to deal with your problems, and you can then sleep better that night. Have a bedtime routine. This is important to make the transition from waking to sleeping. I learned this when I was working 3 to 11. You go home at 11:30 at night, you're keyed up, you want to go to sleep so you can get up. You can't. You've got to have a transition time. I think busy mothers, busy grandmas, busy women, we want to go, and lay down and go to sleep. You need a transition time. Figure out what works for you and how long that needs to be. Maybe you need to read, maybe you need to listen to music, or just sit quietly reading a newspaper. Getting up at the same time every day and going to bed at the same time trains your body to be able to know when to go to sleep and when to wake up. These are basic sleep disorders. What I suggest that you do is call a provider if you have sleep apnea or your partner has sleep apnea. That is, they're not breathing normally during sleep. If you have insomnia and you're too tired to function in the daytime, you want to consult with someone about that. We all have days or nights, that we don't sleep well, and that's normal. But if it's on an ongoing basis such that you're chronically tired and unable to function in the day, that could be physically or it could be mentally, because we know sleep has an effect on both, you want to call. And then restless legs, periodic limb movements, other sleep disorders. My main points were that sleep patterns change across women's lives, okay? From the time of infancy to teenage to being an older woman, your sleep patterns change. You kind of need to go with the flow. Our unique physiological changes contribute to that. We do know that preliminary evidence is showing that the insomnia related to menopause is related to estrone, which is one of the 300 estrogens. So what do we do about that? I don't know. Maybe in 5 years we will be recommending that everyone take estrone. But the preliminary evidence is there. we haven't worked out all the relationships. We know sleep is important, and it's as important as diet and exercise. I encourage you to make sleep a priority, and I also encourage you to go with the flow when you can't sleep. And what they do recommend is to not lay in bed longer than 20 minutes, because then you begin to associate your bed with not sleeping. Get up, do a quiet activity till you are drowsy, and then go back to bed. And I had one woman that I worked with who, she used to wake up in the middle of the night, and she would lay there and think out what she was going to do the next day, then go back to sleep. So sometimes just use that time to your advantage and not try to fight it. And that's what I mean by go with the flow. It's very complex. Periodic limb movements, I don't think we know what causes it, but it's a jerking motion, and usually your knee bends and your foot jerks, and it can be so bad that you kick your partner. And I've had people tell me that then they've taken their husband to the emergency room with a cracked rib because of the kicking in the night, and that's another issue of safety. I don't think we know what causes that, but there are medical treatments for that. There's no one treatment I can tell you that's going to get rid of them. You need to have a complete assessment. And same way for restless leg syndrome. Sometimes they treat that with dopamine adrenergics or something that will supplement dopamine, but again, you need to look for iron deficiency with restless leg syndrome. So you need to know that one is your chemistry okay, your calcium, your potassium, those kinds of things, your electrolytes, and then see what else might be going on. The one caution I would say to you, you can take Benadryl, for example, and there's like 25 kinds of Benadryl. It even comes in bubblegum flavor. You can get a lot of, Benadryl is antihistamine, and its side effect is drowsiness. It can help you go to sleep. I've taken it to help me sleep when I was traveling. It works great. What you have to watch for is that you're not too sleepy the next day, that there isn't a prolonged effect. So to avoid that, you want to not take it too late in the evening. Now, does it have an effect on your sleep architecture, like stages 1, 2, 3, and 4? Some do and some don't. Yeah. It depends on the dosage you're taking, and it depends on how frequently you're taking. And with any sleeping aid, they do recommend that you limit it to 3 weeks. Now, there are people in the room who said, oh, I've been taking this for 2 years and it's still working. That's fine. But we do know that some medications have a rebound effect, and if you take them longer than three weeks, they can cause insomnia that they're intended to prevent. So that can become a revolving door. It can become problematic. But if the Tylenol PM is working for you, I would just say don't try to use it every night, but use it, when you need it. If you have pain, arthritis pain, surgical pain, headaches, those can all disrupt your sleep. And so the best treatment for them is to take something to address the pain, not take a sleeping pill that masks the pain, but to take something for the pain. And so if there is associated pain and Tylenol works for it, yeah. Thank you very much.
3 items of importance rolled into one. The number 1 is to celebrate your body and to give thanks every single day for this physical being that allows you to do what you do and connect with the people you connect with and to experience life in all its ways. The second is to celebrate your mind and to remember that we are always learning. And there's always information available to us in a whole variety of ways. And so be grateful for your mind and your ability to think and learn and process and again connect. And then lastly, celebrate your spirit and remind yourself every day about what gives you meaning and purpose. And what touches you here in such a way that you can't help but express it outside of yourself. You might remember my saying in other years when you've attended this, that the word spirit comes from the Latin word spirare. So the word spirare means to breathe. And so when we talk about renewing our spirit, it's rebirthing or giving life to the ordinary everyday lives that we have. And our intention in celebrating women events is to renew our spirit, to give you a sense of renewal about who you are and how it is that you've been called to live your life every single day. So, 2 questions. What grounds you and what inspires you? Let me just again thank you for choosing to spend your day with us today. See you all at the next time we gather.
Hello, my name is Beth Shank. I am facilitator of Women's Health at St. Patrick Hospital. On March 15th, 2007, Dr. Judy Vischer, a family practice physician at the Western Montana Clinic, will discuss weight management. On April 19th of 2007, Dr. Laura Audio, physician in family practice at the Western Montana Clinic, will deliver a talk called Men's Health 2. To attend these lectures in person, please feel free to come down to St. Patrick Hospital to the Broadway building on the 3rd Thursday of each month until May of 2007 from 6:30 p.m. to 7:30 p.m.